It is no secret that the country's and the region's largest referral hospital, the Kenyatta National Hospital, has been in the news in the recent past for several wrong reasons. The latest and perhaps the lowest moment from the health institution in recent times, the surgery mix-up that saw a patient undergo brain surgery when he didn't need one. As a result of the surgery goof, the new CS of the ministry, Sicily Kariuki, suspended the hospital's CEO, Kericho, and her deputy, Dr. Bernard Githae. But before the suspension of the top leadership at KNH, the institution had suspended the neurosurgeon who had conducted the surgery on the wrong patient. Today, the professional body that covers doctors admit that errors were made in this particular case.
Clearly, there was a problem at some point. And we would like also to identify that problem, see if any professional is responsible for that problem, and then take them through the procedures that are expected to be taken. And as we speak, we are not protecting any cadre. And we do not speak to say, don't punish a wrongdoer. In fact, the practice of medicine is one of the most ruthless. When one of the members of the profession does something that is wrong or something that is against the professional practice.
They, however, insist that due process must be followed in handling this case and that the medical professionals involved must have their day in court.
In that, we acknowledge that any professional who was involved indeed has to be, if found culpable, must be dealt with in terms and according to the regulations governing their profession. And there are regulations across the board. It doesn't matter at what level of profession, there are regulations that will guide that. And what we want to come out of this in-depth audit from the process is to pick all those steps where an error occurred and correct them.
KMA says that while the latest incident at KNH may be the worst in recent times, the institution has been struggling to service clientele under difficult circumstances. While the association accepts the errors and the actions taken so far, legislators from Kericho County are less than pleased by the suspension of the KNH CEO.
For Kericho, it was a matter of when, not if. We saw it coming, and we knew that she was going in the fullness of time to be fired.
According to them, Mrs. Koro's troubles started fermenting with the rape allegations at the hospital. That were then followed by news of the theft of a baby at the same institution before this week's news of the surgery blunder. The legislators say the CEO should not be held solely responsible for the series of unfortunate events at the hospital.
Would you blame the CEO for actions of somebody who just left their own baby with somebody else?
In the last 6 financial years, Kenyatta National Hospital has never received any funding in terms of development vote, so they are understaffed and underfunded. When you're running an organization where you're understaffed and underfunded, the kind of messes that have been witnessed for those that are genuine, like the mistake that happened, which is really unfortunate, on Friday, are bound to happen.
They also say that there is more than meets the eye to what they term as a hurried and unconstitutional removal of the CEO, and that it has to do with financial benefits.
The suspension of Kericho or her exit from KNH is a pre-planned thing by the cartels who want to go back to the Ministry of Health to loot the resources of this country the same way they were looting.
They're now demanding that the Cabinet Secretary for Health clearly sets out what measures she intends to take to redeem KNH. They also want her to reinstate the CEO immediately or step aside. Brenda, Wanga, NTV.